Okay, so you're thinking about studying medicine.
Yeah.
And not just anywhere, but the University of Bologna.
The oldest university in the Western world.
Exactly. I mean,
Yeah.
how cool is that? But, prestige aside, what's the Bologna Medicine and Surgery program actually like? Well, that's what we're diving deep into today.
We'll break down this briefing document we've put together, really get into the nitty-gritty.
So you can decide if it's the right fit for you.
Let's jump right in. One of the first things that grabbed my attention was the clinical exposure. Early, like really early.
Not just shadowing a doctor for an hour, right?
No, we're talking hands-on experience.
Yeah.
From the get-go, you're at the Policlinico di Sant'Orsola,
Which is,
one of the biggest hospitals in Italy, a teaching hospital.
wow. So first year, you're already working with actual patients?
Alongside experienced doctors, seeing a huge range of cases.
That's pretty different from most programs where you're hitting the books for the first couple of years, right?
Oh, absolutely. It's a totally different approach. Think about it.
Yeah.
You're learning about, say, cardiology, and then, bam, you're on rounds, seeing it firsthand, observing procedures, maybe even assisting.
I can see how that would really solidify the learning, make it stick, especially in such a high-level hospital environment.
Exactly. Real-world application from day one.
Now, this briefing document also mentions something called an international focus.
Yeah.
What's that all about?
Well, it's not just a tagline. They've got research collaborations all over the world. Every continent, literally.
Seriously.
And, get this, there are opportunities to study abroad. Spend a semester, or even a full year.
Wait, so I could potentially be doing a year at, like, Johns Hopkins or the University of Tokyo?
It's on the table. They have partnerships with top institutions globally. And the curriculum itself, it emphasizes global health issues.
So it's not just about jetting off to a cool location.
Right. It's about understanding health challenges on a global scale, being prepared to work in diverse settings.
Okay, that makes a lot of sense. Now, there's this term in the document that I have to admit I'm not super familiar with, medical humanities. Is that like art history for doctors?
It's interesting, isn't it? It's about recognizing that medicine is more than just science.
Okay.
It's about people. You're treating human beings, each with their own story, their own background.
Right, the human element. So what kind of courses would fall under this umbrella?
You'll have courses on medical ethics, for example, the history of disease, the role of art and literature in understanding the human condition.
So like how a painting or a poem can give you insights into a patient's experience.
Precisely. It's about cultivating empathy, being able to connect with patients on a deeper level.
It sounds like they're really trying to train doctors who are not just technically skilled, but also compassionate and, well, just good humans.
That's the goal.
Makes sense.
Sure.
Okay, so walk me through the 6 years. What's the overall structure of the program?
So the first 2 years, it's all about the foundation. You'll be immersed in the core sciences, anatomy, physiology, pharmacology.
The building blocks.
Exactly. And then, boom, years 3, 4, and 5.
Political rotations.
You got it. Rotating through different specialties, surgery, internal medicine, pediatrics, you name it.
So that's where you really get to put all that theoretical knowledge into practice, right?
Absolutely. You're in the hospital, working with patients, making decisions.
I imagine that's where the real learning curve kicks in.
No doubt. You're exposed to a huge variety of cases, learning how to diagnose, how to treat.
And then year 6 is where you start to specialize, right?
Exactly. You choose an area that you're passionate about, and you really delve into it. It could be cardiology, neurology, anything.
So you really get to hone in on what you love, potentially even start doing some research.
Could even set you up for a residency program down the line.
Makes sense.
Yeah.
We talked about Bologna being the oldest university in the Western world.
Steeped in history.
Definitely. But beyond the wow factor, does that actually impact the student experience?
You know, it's funny. You can feel it just walking through those halls, knowing that people like Dante, Copernicus, they walked these same halls.
That's got to be inspiring.
It adds a certain weight to the learning, you know? And it's not just about the past. Bologna is still a top-ranked university globally, currently sits at 133rd in the QS World Rankings.
So it's got both the historical prestige and the modern-day academic cite.
A pretty unique combination.
Okay, let's talk about getting in. What does it take to actually become a part of this program?
Well, you'll need a high school diploma or equivalent, and you need to demonstrate English proficiency at the B2 level.
So that means?
An IELTS score between 5.5 and 6.5 or something equivalent. But the big one is the IMAT.
The IMAT.
The International Medical Admissions Test. That's the make or break hurdle.
What's it like? What makes it so challenging?
It's not just about knowing facts. It's about critical thinking, Problem solving, they might give you a complex medical scenario,
Yeah,
and you have to analyze data, interpret results, make a judgment call, all under pressure, of course.
sounds intense.
It is. They're looking at your logical reasoning skills. Can you apply scientific principles to real-world situations?
So the program itself is taught in English. Got it. But
Yep.
there's also the Italian language requirement, right?
You'll need B1 level Italian for clinical clerkships,
Which are?
basically when you're working directly with patients in the hospital.
Okay, so I'm coming in with zero Italian. How am I going to be fluent enough to talk to patients in a year?
Don't worry, they've got you covered. They offer Italian language courses during that first year.
Phew. That's good to know.
And it's crucial, really, to build rapport with patients, understand their concerns.
Yeah, it's not just about medical jargon, right? It's about connecting on a human level.
Exactly.
Okay, so to sum up, what are the big standout features of the Bologna program?
I'd say three things. First, that early and intensive clinical experience. You're in the hospital from day one, learning by doing. Second, the Gribble outlook. The program is designed to prepare you for a world where health issues transcend borders. And third, that emphasis on medical humanities. Recognizing that being a good doctor isn't just about scientific knowledge, it's about empathy, about understanding the patient as a whole person.
They're really pushing the boundaries of what medical education can be. It's not just about churning out doctors who can diagnose and treat. It's about shaping well-rounded physicians who are prepared for the complexities of 21st century healthcare. Really interesting stuff.
And it makes you think, doesn't it, about what qualities we really need in our doctors.
For sure. All right, so that's our deep dive into the University of Bologna's medicine and surgery program. Lots to think about.
Definitely do your own research, check out the university's website.
Maybe even connect with some current